Hi, Dr. Saxena here, and we are going through a mix of a big crisis here in India, and this is quite a big thing which none of us anticipated. And after relatively a good success in handling the COVID crisis with an emphasis on the early treatments such as ivermectin, a lot in fact, the UP government has given door-to-door ivermectin, and they were able to reduce the thing as such, the mortality and morbidity quite early. And everyone thought, okay, we have controlled this particular pandemic, and this sudden surge in cases and deaths, what are they, what is the kind of, why there is we are seeing a sudden wave of deaths as well as injuries following this second wave? What is this second wave up to? Why this there is a kind of consistent rise in kind of cases and all that? And we have reason, I'm just giving a kind of perspective which I don't think everyone will be on the same page, but I just want to what might be the cause. I just want to understand what has changed. Things were doing quite well, and suddenly why there was a kind of this one as such. And now we understand it is the mutant, which is in fact they used to tell it's an Indian mutant, but we know it's a global mutant, and this is one of the causes of increased second wave. And I think we need to slightly go back and look into why this is happening. See, we can't be taking things as lightly as a thing, as if nothing has happened. And I want particularly people who are in the kind of this one should come forward and look into this, particularly for doctors like us. And if we don't want to question things and all that and take the things as it is, there is something things can't be taken lying down. And you say no, it is because of the social congregation and all that. This social congregation was happening before also. In the last 2020 also it happened. Why in 2021 it has gone into out of control? So some things are not matching, and you need to connect the dots here. Somewhere we need to understand why there is a kind of so many sudden increase in things. And I would like to discuss here, is there any role of this mass vaccination attributed to the surge in this particular thing? I have sufficient data, and I can always discuss it on any kind of platform with anyone, and I can always prove that this is one of the plausible things. And we have reasons for that. And somewhere because this vaccine, whatever we are giving, that it is not capable of handling this mutant strain. And not just this vaccine, two vaccines, I can always tell, even the Pfizer vaccine and all that. That's the reason the other countries have stopped. They have warned people from they not to enter into India, because even if we have seen the person, a doctor who has taken 2 shots of Pfizer vaccine, he comes here, and he is taken for he died of COVID, this one. So the thing is, I've been on a trying to understand what are the things which might have gone wrong and all that. But the WHO admission that there's a mutant as such, B1, this particular stuff. And apart from that, the reluctance of the people to there's a kind of to contain. So what I believe is, it just by again mass vaccinating with the same old stuff is not going to help in this present second wave. We need to develop some booster doses. We need to work on some other things because none of the vaccine people are talking this can be helpful. That it's all theoretical things. There are some good people. There are some doctors of the very high repute. They took the jab 3 months back. Most of the frontline workers, and now some of them are really struggling in the ICUs. It is really a big cause of concern, and for our doctors community we can't take things lying down, and at the same time we are asking everyone to go for this particular thing. This is not a sensible approach, what I believe, and we need to took what happened in Mongolia did witness a near zero surge during and when the mass vaccinations rolled out, there was a sudden increase in number of deaths and all that. There are a lot of I can always go in USA also. There is a thing called red and blue states. um, um, uh, See, we can always explain the new mutant strain in India. Somehow explain the vaccination mortality correlations in Mongolia also. When I'm talking about red and blue states in US, some of the things just weeks after Texas, you have got Florida, you have got Arizona. These are red states, and they have moved to ban the vaccine passports, and uh, there is no virtually no annual flu which is happening in US now. Absolutely disappeared, and we need to connect the dots. There is a palpable kind of thing, and we don't want to get into how it started, why it started, all that. But at this present time, we in India, we are suffering a lot. We people are losing the battle, and it's as doctors working for a social kind of responsibility. Um, we uh, we we feel they are completely helpless when someone gives a call. They say they need a kind of ICU and they need a kind of hospital. They need oxygen. They need remdesivir. We are not able to provide any of such thing. So what we as a kind concerned citizen, as a concerned person, I want all of the medical professionals to start thinking why this sudden surge in second wave has come. And somewhere, see, there is always a cause and effect, and you cannot, if you cannot understand the cause, and you just try to focus on the effect, try to reduce that particular thing. In before see If you don't remove the cause, you will not cannot get a correct answer about that. And the most plausible cause is that mass vaccinations, and I can discuss this with any person, the kind of any scientist across, and I can show him the data what we have worked out and all that. And this should cause a end to this particular ongoing uh, big catastrophe which is happening in India, and we can't be just poor spectators trying to see, this is, you have to add this. You start discussing about what must have went wrong. No, government is at fault. The people is at fault. They are getting into. They are not following social distancing and all that. This is absolutely rubbish. You need to come out of this and try to look at the large picture, and try to hit where it started. Then only things will be better. If you are just looking at symptomatic treatment, you cannot just treat symptomatic fever with paracetamol for 100 days, unless you pick up what is it a anti it's a malaria, or it's a typhoid. Then you pick up the typhoid malaria drug. Then you don't have to give symptomatic treatment throughout. Try to find out the cause. What must be the cause here? Yes, the cause is the mutant strain, but why mutant strains are there? The more we have data now, the more you vaccinate, the more you do that, the mutants are going to increase, and we don't have that kind of. Um, uh, we cannot manage this particular thing. Even the people who are in the best of kind of things, they are not able to find out the bed in a hospital. So be I this is a wake up call for all the medical professionals who are in India and abroad, and we have to take a call. We can't just get dictated by someone who is not sitting here and gives every day one particular possible this one answers. They say it is because of this only. This is something. Even why, if the Pfizer vaccine can control these mutants, why the hell the countries who have vaccinated them, people with the Pfizer vaccine, they are asking their citizens not to go to India, because they are afraid if these citizens come to India, they will be knocked off. So right now there is no vaccine which is able to work on this mutant strain. Somewhere, I think we've been taken for a ride, and this is a request for all medical professionals to go through this, and we will try to see how best we can work it out. Thank you.